Greetings, everyone. Appreciate everybody joining our quarterly educational webinar. We're going to give uh, folks a few minutes to come on that may be taking time away from the clinic and need to step away from their job for a minute to listen into this webinar. Grateful for everybody's time this afternoon. See, we've got a few more folks joining. Greetings, everyone. Thank you for joining our webinar this afternoon. Looking forward to this topic of specialty accreditation. We'll go ahead and give some of our folks that are still popping on here a few more minutes to join before we get started. But I'm grateful for everybody taking time to attend our webinar today. So thank you so much. Well, we do have a jam-packed agenda today, and I imagine that we'll still have a few folks that are straggling coming on here, but I'm really grateful again for everybody who is attending our webinar today or is watching this on a record. I'm just really grateful for the opportunity to speak with you all today. My name is Casey Foster, and I'm the Senior Manager of our Medically Integrated Dispensing Solutions program here at Cardinal Health. And I've been involved with Medically Integrated Dispensing Solutions for the past 8.5 years here at Cardinal, and have been working with medically integrated dispensaries to set up and implement their own dispensing programs within physician office clinics for the entire time that I've been here at Cardinal during that 8.5 years. And today, I'm looking forward to the opportunity to discuss with all of you a little bit about specialty accreditation and understanding why specialty accreditation is important to practices that are operating medically integrated dispensaries. And just to get this out of the way, we are going to provide a little legal disclaimer here at the front end of this webinar to talk before we dive into some of the conversations regarding accreditation. So just for everyone's awareness, this information is for educational purposes only and is not intended as legal, compliance, or business advice. Cardinal Health disclaims all warranties expressed or implied regarding the information provided, and each participant remains solely responsible for all compliance and legal requirements applicable to such participants' own activities. So now that we've gotten that out of the way, I'm looking forward to today's agenda to talk a little bit about accreditation. And I wanted to go over specifically what we're hoping to cover today throughout the course of this webinar. We're going to talk about accreditation programs in general. Specifically, we're going to highlight three specific accreditation programs, that being URAC, ACHC, and NCODA accreditation programs. And we're also going to talk about why these specialty accreditation programs are so important for practices that are operating medically integrated dispensaries. And finally, we're going to talk a little bit, or secondary to that, we're going to talk about the basic requirements that are associated specifically with ACHC accreditation. Now, there is some overlap between URAC and NCODA accreditations in terms of the requirements that are associated to obtain these credentials, but we're really going to focus this webinar on ACHC, and we'll talk a little bit about why that's going to be the focal point of this webinar, and why we tend to recommend ACHC for practices that are seeking to gain some type of accreditation for their medically integrated dispensary. And finally, we're going to highlight the ACHC accreditation process. We're going to specifically talk about how to get started if your practice has not undergone the ACHC process or doesn't know what's all involved, and kind of talk about an expected timeline that practices can hopefully utilize when they're working towards their accreditation, and have an understanding of how long this process actually takes to complete not just the actual survey that will be a part of it, but also the completion of the work that is required in order to be able to satisfy the requests and requirements of the ACHC survey. So just as a note, I also understand that we have a chat and a Q&A that is available, and my national account managers, Andrea Hughes and Briar Watercutter, are on the call as well, and they will be monitoring the chat Q&A. So if you have any questions that come up throughout the course of this webinar, please don't hesitate to put those into the chat, and our team will make sure that we're answering all of the questions that are associated with this webinar throughout the presentation. So feel free to put those in the chat whenever. And there will be an opportunity for a more broadly based Q&A at the end of this webinar. So what are the types of accreditation programs that are available? And it's first important to note that we have three of them that we are highlighting during this webinar. There are multiple accreditation programs that are available for practices to be able to participate in. And it's important to understand that in terms of which accreditations are recommended or are best for a practice to be able to go and obtain, it's really kind of individualized to the practice itself. There are certainly recommendations that we would make, and we certainly have preferences that we think are more successful and are more indicative to successful medically integrated dispensing programs. And those three are highlighted here. But there are other options, and I would encourage any practice that is interested in learning about some of these other accreditation programs to understand a little bit what their payers are specifically requiring from them in order to identify which type of accreditation program is best for a practice to be able to go through. These three are obviously the ones that we're really going to be highlighting today, and are the ones that most of our practices here in medically integrated dispensing solutions that our practices are working with. And we're going to start today with the Accreditation Commission for Healthcare, or ACHC. And you'll notice that the cost estimates that we provide here, specifically for ACHC and NCODA, have asterisks on those accreditation costs. And that is simply because of the fact that there are Cardinal Health GPO discount codes that are available to obtain these accreditations. And so the first step that we talk about once we get into how to get started with any of this is to reach out to your medically integrated dispensing solutions account manager so that they can provide you with those discount codes and help you be able to obtain these accreditations in a cost-effective manner. But as we're talking about ACHC specifically, there's a few different types of accreditations that are associated with ACHC. And beyond that, there are even further distinctions that are available for ACHC accreditation. And these types and distinctions are selected by the practice during the application process in terms of what type of accreditation that the practice would be going for. Most of our pharmacies and most of our dispensaries are operating in specialty pharmacy or medically integrated dispensing accreditation through ACHC, and some of them are obtaining oncology distinction. And we'll talk a little bit about what oncology distinction specifically means in terms of the process of accreditation, but that for now, what it's important for you to kind of understand is that to obtain that oncology distinction is simply going above and beyond what the minimum requirements are for the ACHC accreditation within your medically integrated dispensary. You'll also note that we have a timeline here that is also listed as 3 to 6 months, and that is simply for the ACHC process to occur. Once the surveyor has been contacted and once the application has been put in place for ACHC, that is the timeline of 3 to 6 months that we're typically seeing. And we'll talk a little bit more about what we think it actually is taking for practices to be able to complete the entirety of this process, from writing all of the policies and procedures to gathering all of the necessary documents and ultimately going through the survey inspection. So just kind of understand that 3 to 6 months timeline is an estimate that's provided from ACHC, and I'll go ahead and say that we find that it takes practices a little bit longer to get through that, and we'll go through that more specifically once we get to the timeline discussion of ACHC. Secondary to ACHC is URAC accreditation, and this one is very much more expensive. That's the first thing that I'm sure our attendees are noticing as they're looking at the differences between all of these. But a lot of that additional cost that is associated with URAC accreditation is tied to data validation and pharmacy data validation that is completed by a third party outside of URAC to ensure that all of the data is meeting the requirements of the URAC accreditation. And so that data validation is what is really driving that cost significantly. There are some tiered pricing options that are available, but regardless of the tiering that you're going with, because of that data validation component, our practices are typically finding that URAC is the most expensive and the most labor-intensive accreditation to obtain. It is considered to be a gold standard in specialty pharmacy specifically, and there are some payers that are absolutely requiring URAC accreditation at a minimum to be able to participate in specialty networks. But in order to be able to obtain that URAC accreditation, a dispensing program has to be very robust and have a lot of additional components in terms of, like I said, data validation and ensuring that all of those people that is not associated with an ACHC or an NCODA accreditation. So there are, it's a significantly longer process as well. In order, practices start working with URAC, and it's going to take them 9 to 12 months to be able to complete the entirety of the 4-pillar process that is associated with that. But it is, like I said, the gold standard and widely recognized by payers, specifically who are the ones that are requiring a lot of these accreditations, as the gold standard in specialty pharmaceutical care. The final accreditation that we wanted to talk about today specifically is NCODA, and that's the National Community Oncology Dispensing Association. And this accreditation has risen to prominence in the industry here only recently, simply because of the fact that it has obtained some additional recognition from payer networks, specifically the Integrated RX network, which is associated with Blue Cross Blue Shield plans that are tied to Prime Therapeutics. And so they are allowing, they being Integrated RX, participation in their network, which would gain access to Blue Cross Blue Shield plans within the state, within the states that it's applicable to, by allowing NCODA accreditation and only NCODA accreditation as one of the verifications that a pharmacy is able to participate in that network. So when that was just a few years ago that this program for Integrated RX kind of came into the marketplace. And so we're starting to see more conversations. NCODA is continuing to have conversations with payer networks to gain additional access and ability to be recognized as a viable accreditation program works. And a lot of practices really like the NCODA accreditation process because it is more so of a situation where practices are teaching other practices about their goals, their best operating procedures, and their best patient care standards. And I think that there's a lot of desire between practices to be able to work together to forward the goals and make sure that everybody is doing the same, keeping the patient first and really focused on a lot of the goals that NCODA espouses as a advocacy organization for community oncology dispensing. So those three are really the big three that we see the majority of our customers in medically integrated dispensing solutions working with, and a lot of the industry partners that we are having conversations with about accreditation and the value of this type of a program within a medically integrated dispensary. These are the three that are being recognized by most industry partners. So that kind of talking about, now that we've covered those three basics, let's talk a little bit about why is it important to even go through and do all of these things and incur all that additional expense and be able to, in order to be able to dispense to patients. And ultimately, it's because of a rise in the industry here in recent years of requiring specialty accreditation in order to be able to participate in payer networks. When I was involved directly in the account management of our working directly with our accounts, Express Scripts rolled out a program where they would require practices that are dispensing greater than 25% of medications from their dispensary as specialty drugs. They would be required by Express Scripts to obtain or to go through Express Scripts specialty credentialing program, which would require the practice to obtain some type of specialty accreditation, whether it be URAC or ACHC or another type of specialty accreditation. When Express Scripts first rolled this program out, NCODA had not completed their accreditation process yet, so that wasn't an option at that point in time. But I think as the Express Scripts specialty credentialing program has grown, they've allowed for additional types of credentialing and different types of accreditations. But it is very much a requirement by Express Scripts in order to be able to participate in their specialty network. Practices have to have some type of accreditation that has been approved by Express Scripts. And so when we were working with practices, a lot of times Express Scripts would reach out to our practices that did not have specialty accreditation and say, you know, you have been identified as a specialty medication provider. You're going to have to go through and obtain specialty accreditation. And that would be when our team would start engaging with practices to be able to go through and get that specialty accreditation so that they could continue to participate in the Express Scripts networks. Another network that we're seeing require certain specialty accreditations is Optum. Historically, Optum went through a period of time where they were actually requiring two different types of specialty accreditations, and one of them had to be URAC. And those requirements have changed, and different requirements may be in place now, but Optum is in a position where they, in order to participate within their specialty network, are requiring that the practice have specialty accreditations in place. And then finally, another network that we talked a little bit about here previously, the Integrated RX network, which is associated with Blue Cross Blue Shield programs in the states of Alabama, North Carolina, and several others, requires that a practice have that specialty accreditation in place too. But what was interesting about Integrated RX was they were kind of the first and most prominent program to allow for that NCODA accreditation we had referenced earlier in this presentation. And so that, I think, has caused some of these other payer networks to look at NCODA accreditation a little bit more as a valid partner and attempt to consider, hey, is this something that we could actually utilize to ensure that the patients that are insured by our benefits are receiving a certain standard of care? And ultimately, that's really what is the reasoning, the driving force behind why payers are requiring that practices have these accreditations in place. Because ultimately, it's having this ACHC or NCODA or URAC accreditation is showing that a pharmacy has achieved a certain standard of patient care. And so payers want to work with practices that have these accreditations in place. That way, payers are certain that certain policies and procedures have been in place, that they can ensure that their beneficiaries are being treated by the same at the same level that they would want their patients to be treated at in other dispensing locations. And it ensures that the patient flow within that clinic is appropriate for the standard of care that is associated with those accreditations. So really the standards that are tied to this are really driving towards some of these things that are over on the slide here. Improvement of patient satisfaction, improvement of provider excellence, and continuous improvement of dispensing activities and operations within the clinic. It allows for practices to have opportunities for professional development of employees within the clinic. You know, we work with clinics a lot of times that employ pharmacy technicians that utilize this as an opportunity to grow their own professional skills and networking in terms of being able to ensure that all of the standards and accreditation policies and procedures are in place. It allows for the opportunity for members to train both new members of the team as well as old members of the team that might not have had that standard of care put into their training originally when they would have gone through their employee onboarding. If the practice did not previously have that ACHC accreditation prior to the onboarding of that employee. So there's a lot of things that this program will do in order to show payers the value of the work that is being done in each of your medically integrated dispensaries each and every single day. And so being the ACHC and NCODA processes, which really document those operations and activities that each of you are doing to take care of patients, it's really kind of showing that you guys are achieving a standard of care that is appropriate for patients that are being seen within the clinics. So now that we've gone through the importance of ACHC accreditation and the importance and some of the various types of accreditations, we're going to really kind of focus in on ACHC for the rest of this webinar and talk a little bit about the basic requirements. And I'm not going to go into extreme detail on this slide. Basically, what we're wanting to present here and make sure that practices are aware of is that on the left, pretty much anybody who has a medically integrated dispensary within their clinic that is servicing a minimum number of patients as set forth by ACHC is able to submit documentation to ACHC to prove that they are meeting these standards that are associated with the ACHC accreditation. And when we're talking about the standards and some of these different things, these standards are divided into 7 chapters of a workbook that is available for members who want to be involved in the ACHC process. And I've listed out those seven chapters on the right-hand side of this slide and included an 8th chapter at the bottom there, which is the oncology distinction. So we talked a little bit about the distinctions in an earlier portion of this webinar, but essentially, in order to obtain ACHC accreditation, all of the policies and procedures that are associated with these 7 chapters have to be in place. And there's a lot of policy and procedure that is associated with each of the chapters that are listed. In order to obtain that oncology distinction, it's kind of like a bonus chapter. It's an additional chapter that has different sets of policies and procedures that have to be in place in order for a practice to be able to say that they are an ACHC accredited medically integrated dispensary with oncology distinction, which will allow payers to treat the practice appropriately in terms of access to payer networks and reimbursement mechanisms. So really important to kind of just keep in mind that as you're going through this, those policies that are associated with those first 7 chapters are what is kind of at a bare minimum required in order to be able to obtain the ACHC accreditation. We find when we're working with practices that some practices have a lot of these policies and procedures just in their medical office as a opportunity to just kind of transition those over to the pharmacy. Some practices don't have as robust P&P in some of these areas. And so we essentially are working with practices to be able to obtain all of the P&P that is associated with each of these chapters. So that's kind of the basics of what is required and how this kind of looks. So let's talk a little bit about the process and what you're actually going to go through in order to get all of the policies and procedures in place that are included within those 7 chapters. And we'll talk a little bit about an expected timeline for some of these things as well. So first of all, when we're talking to practices that are interested in getting started, the first thing that I like to call out is that our medically integrated dispensing solutions team, myself, Andrea, Breyer, as well as our leaders and many other folks within the Cardinal Health team are all certified ACHC consultants, which means that we have the ability and have gone through specific training from ACHC to be able to take practices from a state of, hey, we are not currently an accredited pharmacy, all the way to we have ACHC accreditation with distinctions if that is something that the practice is interested in pursuing. And so as our first recommendation to any practice that is interested in this is to first speak with their MIDS account manager. And our MIDS team can guide you in terms of getting the appropriate resources for ACHC accreditation. There are workbooks and FAQs and policies and procedures that are available on their website. And I think that it's a really wonderful resource for practices that are interested in learning more about the accreditation, but would still strongly recommend that you begin working with a certified consultant in order to gain access to, in order to obtain this accreditation. The second step is to prepare for the survey. Essentially, ACHC will after the application and after a practice has indicated readiness, we'll send a surveyor on site at the clinic to inspect and make sure that the practice is meeting all of the requirements that are associated with ACHC. Our team hosts bi-weekly or weekly meetings with our customers to walk through all of the standards that are associated with those seven chapters and make sure that all of the appropriate policies and procedures are in place. We would encourage practices that we work with to then ensure that their staff are appropriately trained on the policies and procedures and implemented those policies and procedures in the day-to-day operations within the clinic in order to make sure that when the surveyor comes on site, the practice is ready to and is already completed with the implementation of the ACHC standards. Once all of the prep work has been done, an online application is filled out and completed, and an application fee is paid by practices. Once that occurs, there are 4 steps that take that 3 to 6 months that we were kind of alluding to. That preparation work, that I was just speaking to, sometimes can take a little bit longer than the 3 to 6 months. So we encourage practices that are interested in doing on this to get a jump on it, simply because of the fact that it is going to take a little while to make sure that all of the P&P is in place and that that the staff within your clinic is appropriately trained on all of the activities that are associated with dispensing. But essentially, once that online application is complete and an agreement between ACHC and the practice has been signed, there will be a preliminary evidence report that is submitted to the ACHC surveyor, and it's simply a list of, and it's including most of the documentation that the surveyor will be looking for when they come on site, and ensure that they have kind of a pre-read through all of the P&P that will have been worked on prior to this moment. And finally, a survey would actually be scheduled. And this is where a ACHC counselor or surveyor would come on site to the clinic and go through the P&P and ensure that all of the members of the staff are appropriately trained on the policies and procedures that are put into place. And this is usually the survey it can be scheduled within a 30 to 60 day time interval after the submission of the preliminary evidence report. But just want to make sure that practices are aware that this is all subject to the ACHC surveyor who would be coming on site and their scheduling. So let's talk a little bit and wrap up here on what can happen after the survey occurs. There's essentially four different outcomes that are important for practices to kind of be aware of. The first is approval. This is what everybody obviously wants, and not everybody gets it on their first run through, but essentially it is effective as of the date of the survey. And there is basically, if in a situation where an approval letter is issued, they want, if there's any survey standards that are not met and still approval is granted, that there be a corrective plan of action submitted within 30 days. There's also a pending status that practices can obtain. And there is a plan of correction that is required for any of those standards that are not met, that is required within a 30-day window of the survey. And the ACHC will review that plan of correction and then from that point indicate a different judgment, whether it be approval, rejected, or dependent. Dependent status is indicating, hey, we're not quite ready. There needs to be some additional work here in order to complete the ACHC accreditation. And there would be a different survey that would be associated with that. And then finally, a denial status, which would need to be either appealed or reapplied and attempted to regain ACHC accreditation when the site is ready to be surveyed for a second time. It's a brand new application in that instance, and it's not a refundable deposit, and there will be additional fees. We find that practices, their ACHC is not really in the business of trying to deny folks. They would much rather have a pending status or dependent status and give a practice an opportunity to put in corrective action. A lot of what ACHC is standards are talking to specifically is continuous improvement and ability to improve the standards of patient care that are being seen within the clinic. And so that's part of the reason why these plans of corrective action are important and allowed within ACHC and encouraged to be able to have practices actually meet the standards and ensure that all of the proper policies and procedures are in place in order to dispense appropriately. So in closing here, we just wanted to provide a few additional resources that are associated. There are websites for all of these accreditations, and we actually included a link here to another type of accreditation called Community Pharmacy Practice Accreditation Program, which is a newer accreditation that is also one that has a lot of wonderful resources online. So we wanted to provide that as a link in this webinar. So in closing here, just wanted to thank everybody again for their time and attention on the webinar today. I haven't seen any questions pop up in the chat, and I know that we are a little bit over time, but if there are any questions, our team is going to hang out here and we'll answer those. Feel free to put them in the chat. Andrea, I didn't miss any questions throughout this, did I?
No, we have no questions at this time.
Okay. Well, if anybody has any questions, please feel free to jump those in the chat. Otherwise, thank you for your time today and appreciate everybody's attendance on the webinar.
Casey, we have one now.
Excellent. Are there any groups where we can network with others that might be going through ACHC accreditation? And I think that that's a really great question. Part of the ACHC process is really about working with others. And the group, I would encourage you to reach out to your medically integrated dispensing account manager, as they're working with multiple practices, both Briar and Andrea, as well as several others within our clinic or within Cardinal Health that are going through ACHC accreditation. So we'd be happy to connect you with other practices that are going through this process right now. I would also suggest that the NCODA, as well as the Community Oncology Alliance, COPA, message boards likely have lots of member practices that have gone through these accreditation processes and have a wealth of information available.
And we have one more, Casey.
Give me just a second on that one.
What's the best way to get in contact with your team?
We have a GMB that I would encourage anybody who is interested in learning more about medically integrated dispensing or about ACHC accreditation, and that's GMB-MIDS, Medically Integrated Dispensing Solutions at cardinalhealth.com. Well, seeing no more questions in our chat, I am grateful again to everybody for jumping on our webinar today. Thank you so much for your time. And please don't hesitate to reach out to our team or to your medically integrated dispensing account manager if you have any additional questions. Thank you so much.